Good morning or good afternoon, everybody. Just afternoon. Welcome to another demo day. We have two guests for today. We have Anthony Diaz from Health Hero and Bruno Calderon from Miticket.cl. So we have the luxury of getting two pitches today. So Anthony, Bruno, welcome to today's session.
Absolutely. Great to be here.
So as you know, these demo days are part of kind of like a benefit for our Slidebean customers and for members of the FounderHub community. So the idea is we bring in two companies every week, one or two companies every week. We let them pitch. It's practice, it's exposure. You get opinions from our audience, and you get questions from the audience, which also should give you a little bit of an idea of the stuff that's maybe missing or confusing on your pitch deck. So if you're interested in participating, it's free. Just shoot me a message through either of these channels, and I'll be happy to send you the schedule. Anthony, Bruno, we'll get some questions from the audience, and so be ready to reply to those. We'll get started with Anthony from Health Hero. Man, whenever you're ready, let's get started.
Let's do it. All right. So, all right, sharing out my screen now, and great to connect with everyone here, and everyone can see my screen, right, Kaya?
Yeah, we got it.
Okay, great. So great to meet everyone. So we are Health Hero. We are Instagram-powered health insurance. And before I tell you about what we do and how we do it, I'll tell you about why we do it. I'm not your typical startup founder. I was not born and raised here in Silicon Valley. I was born in Brooklyn. I'm of Puerto Rican descent. Did not grow up with a lot of money. I lost my dad to heart disease. He was only 58. He deferred a medical procedure that could have saved his life. Turns out that a lot of Americans cannot afford their health care. So we are creating a modern health insurance company, and we are Instagram-powered health insurance. The net here is that healthcare is not affordable, period. Who says this? The whole United States of America. So healthcare is really super expensive, but there's some interesting opportunities to be able to offer healthcare now for a fraction of the price that everyone knows of what is out there today. The most important thing is our traction. We are growing fast in a really big market. We're closing 5 million. We've got 70% committed. We're eyeballing an annual revenue this year of 4 million ARR. Next year, we'll do 15 million. The following year, our goal is to do 40 million. What's really important is health insurance. Think about health insurance for $200. A lot of people get health insurance through their company, but for self-employed, for contractors, for freelancers, having health insurance is sometimes not even an option. But can you even get health insurance for at least $200 or less a month? And the answer is no. Through association health plans and through partnerships with United Healthcare, with Visa, variety of other partnerships and mechanisms we put together, we are forming the three foundational elements for health insurance that all the health insurance companies wish they had out of the gate. We're community at the core. Our integrations work with everything from Instagram to Salesforce to Cerner to Epic, all the different enterprise applications out there, able to reach markets and to reach people, small micro businesses, small medium-sized businesses, freelancers, very effectively. We're community at the core, recognition, rewards. And we also have a credit product that is appropriate for people to put their medical expenditures on there. We partner directly with Visa for that. Visa does not partner with startups, so they believe heavily in what they're doing. The demo, if you think about it, right, it's about getting onboarded very quickly, talking with our bot via web, via mobile, via Instagram, and basically capturing all of your demographic information, asking you some questions, basically getting you set up in less than 30 seconds through our chatbot. You can also record your healthy activity through our Instagram application, iOS application, connect your Apple Watch, connect your Fitbit. We connect with all the different types of methods out there, over 10 different methods to capture your healthy activity, and you're getting rewarded for your well-being. So we're well-being insurance. Think about it. Well-being is everything, and your well-being drives your health insurance costs with Health Hero. The market is big, $60 billion total addressable market. The serviceable addressable market is $16 billion. The market we seek to capture is a $5 billion market. The competition out there is traditional health insurance, Oscar health insurance, which isn't doing too hot. And there is the infamous, I don't want health insurance. I can't afford health insurance. And that is what we're combating today. The underlying magic, it's a bot that works with all the different enterprises and social networks that are out there. We connect with a passionate global well-being family community. We're omniversal, which all that means is we're multi-channel: calls, text messages, secure chat, connecting through social and enterprise networks, popular applications like Instagram, Facebook, Salesforce enterprise applications, Cerner, Epic, Microsoft. So we do API integrations that allow us to get to small and medium-sized businesses very effectively, which is our go-to-market. We integrate with over 20 enterprise consumer applications, which makes us, at our team size, not have to hire a super large sales force. We're efficiently getting to market, and we're a determined team. I built and coded claim systems out of the gate for Value Options, the largest managed mental health care at the time. Montgomery Lenny is our CTO. Steve is our data science and channel integrations expert. Jonathan Trudell keeps our customers happy. Angel runs operations. And then Tristan is our senior engineer, mobile engineer, and chatbot engineer. Our mission is 1 billion happy, healthy lives. Our values are love, greatness, and unity. Join us. Thank you.
Awesome, Anthony. I think that it's very clear that this is not the first pitch deck that you've made, because you have this thing nailed. You were 4 minutes and 20 seconds, which I think is good, on the sweet spot. I have some comments and questions about it, but I also want to remind everybody that if you have comments and questions about the pitch decks, feel free to share those directly on our Slack community or directly on our YouTube channel chat live discussion thing. I want to move on to Bruno now, and that will leave everybody some time to move into questions and so on. So Bruno, whenever you're ready, did you lose Bruno? Bruno, I lost your camera, man.
I'm here.
I got you. Okay.
I'm gonna share my screen right now so we can go on my pitch deck.
There you go.
Okay, sounds good. All right. So my name is Bruno Calderon. I'm the CTO of Miticket, and we're trying to disrupt the e-commerce model on the events world in Chile. So first question is, who likes to do online to purchase online? When you have like big events in Chile, you have to do online to purchase online. Nobody. It's internet. So the problem is, first one, the service fee is too high for the level of service provided, because the providers of ticketing right now, they don't have the servers or the technology to make up to these big events. The current platforms are not designed for a demand search, so they have to put a line and give people a number to make a purchase. And the third one, there's like no e-commerce model being applied in the industry, so nobody knows who their customer is, what's the revenue per customer. There's no KPIs. So our solution is a 100% online-based ticketing company, saving on operations because we're not going to have physical store to print tickets. We're going to have better information for the promoters. We're going to give them access to relevant KPIs, and we're not having to have customer complaints on server errors or lines to purchase. The market validation is a huge market. Ticketek.com, which is one of the market leaders, issued 1.3 million tickets per year. And Punto Ticket, which the other big competitor, has 52% of the market. The market size is $360 million per year. 60% of that is online, and we are aiming for 1% of market participation. Our product is very simple. It's a very modern website, and in 3 clicks, you can buy. Our competitive advantage is we're going to be the first to market in a high availability system, and we have a battle-tested checkout able to handle 10,000 customers per minute. Our business model, we take a 12% fee in each transaction, so the business volume will be 1,500 million Chilean peso, over 1% of the market we are aiming. That's going to be 3,600 Chilean peso, which is about $5. And we're aiming for 180 million Chilean peso annual revenue. Our market adoption, we will have events available to negotiate. We have promoters open to sign agreements with our ticketing software. We have 3 promoters. And we can also license the software for venues to use online. Our competition in Chile is the following. We have Eventbrite, Passline, which are like new on the market, and then we have the established players, Punto Ticket, Ticket Pro, and Ticketek. And we have 2 more players which are like entering in the same time as now. We're looking to finance 12 months of operation to be profitable on the 13th month. and we're looking for 60 million Chilean peso on a convertible note. We're seeing at 800 million valorization, so it's going to be about 8% of the company. That's it. Thank you so much.
Cool. Thanks, Bruno. Thanks, Anthony, for pitching, and let's get to the good stuff. So, Anthony, like I said, I think that your pitch deck, you could see that it's certainly not the first time you pitch. I was a little confused though at the beginning because you mentioned, I think it's a combination of your round committed and a combination of your annual run rate. I wasn't sure if your first slide was, you said $4 million, 70% committed. I'm assuming that you're talking about your round.
Yeah, we're raising a 5 million round, and 70% of that 5 million round or Series A is committed. And just I kind of fit a couple of metrics on the same slide just to kind of, in terms of traction. So we're approaching $1 million of ARR right now in terms of revenue, and then we're seeking eyeballing 4 million ARR by the end of the year. Yeah.
Okay, that's cool. Yeah, I was a little confused about that.
Yeah.
Maybe.
Yeah.
But that's okay. So this is great. You're, being very transparent here. You're a company in a similar size to ours. On the $1 million and some annual run rate, which is cool. I think that that's absolutely something that the next time I'm pitching, we're not raising money now, but the next time I'm pitching, I'm absolutely leading with traction. Also, when you're raising a $5 million round, traction is absolutely the number one question. I'm curious about the product. So it's so I understand that you're using kind of like new channels, Slack, Instagram, to position your insurance. I think that the AI bot as an acquisition method. I'm assuming that what you're doing here is sort of removing the need for a human being to sell the insurance. Is that where
Right.
people save money, or do you guys have another type of insurance that also, allows you to keep costs down?
Yeah, no, so our foundational revenue stream really comes from engaging people in their health using multi-channel, so bots, automated phone calls, and text messages. And we've been selling that product foundationally to hospitals and to organizations for roughly $5 per license per month. So that's set up a very good foundation to be able to nudge people and engage people in their health. And if they have a disease state, to be able to nudge them to do the right thing at the right time. And essentially through the product, through the bot, yeah, it's reducing the middle person. It's easy onboarding, but essentially engaging people in their health. Health insurance companies, they really make the most money by creatively carving out people with bad risk, and then that, just to be very straightforward, that's how you make money. And so we're creating welcome boundary lines with our product by engaging people in their health and focusing on groups, industries, startup organizations, tech companies, self-employed, freelancers, groups that are naturally healthy to start, and focus on those well-being individuals and being able to capture their healthy activity through all sorts of consumer-friendly ways, all the way from Instagram. You can take a picture of your workout selfie, take a picture of your salad. We analyze it. It's just one different type of method. We connect with Apple Health, Fitbit, all these different types of methods to be able to capture healthy activity and carve really good risk clusters. And then using an association health plan mechanism, which the government put out towards the end of last year, the combination of that is what allows us to offer really cheap health insurance. So
I think that's certainly very smart. My own experience getting insurance, you have to validate, you have to go through your health exams and whatnot. So I guess that there's this new public social media approach to doing it, as long as you stay GDPR compliant, I guess.
Yeah.
Then I think it's
Yeah.
a very good way to approach it.
Yeah.
I'll get back to you, man. Again, people
Yeah.
in the audience,
Yeah.
feel free to ask your questions or send your comments. Saying hi to Michael, who's watching us from Kenya. Bruno, moving on to you, if you're still with us. I muted you because you were a little noisy, man. Go ahead and unmute yourself because we can't hear you.
Okay, no worries.
Yeah, I gotcha. Okay, so that's, I guess, traction is also the question. So I see that you're raising a much smaller round, but I am interested in where you are in the development of this product.
So
I guess
we have so we have MVP. We tested it on March. We sold about 600 tickets. We got about 1.6 million Chilean peso. So we have like an initial small amount in the company. In terms of traction, we will start with the same size of events. So we are going to start selling 500 tickets per month with an 8.3 grow per month, month over month. So that's why we are going to be profitable by the 13th month.
That's okay. So some tips, and the idea here is to kind of learn all from the progress. You're saying this like it's a fact, and that's good and bad, right?
Okay.
You're saying it's like we are going to grow 8.3% month for month. Man, that's really, really hard to guess or know. Like nobody knows. You can put it in your financial model, but it's you're never gonna know until you do. So and if you have traction, if you have sales, I normally talk, I would absolutely lead with that. Like we are growing, we have grown X amount month over month.
Okay.
But yeah, just assuming growth like that, or you got to make sure that you phrase it correctly, right? You either phrase it as we've partnered with these companies, or we've partnered with these events, or we have these events lined up, which we expect will generate as much. But if you just say adding X number of tickets per month, which will give us 8.3% growth, it could be perceived as naive from your end, as to how you plan to scale. If you're selling tickets, and if you're and this is a question that I'm gonna kind of move to Anthony after you answer it. But if you're already selling tickets, if you've developed a platform, why do you need the money? Why are you using the money?
We need the money to move from the MVP to the actual product. We need 3 months developing. We're actually looking to increase our staff. So that's what most of the money is going to staff and to pay for server and that kind of stuff.
Yeah, because that's another question that I a little bit relates to kind of like where you were phrasing your pitch, right? So if you're saying if you're spending all your money on the product, or all your round is planned to the product, which is what you just said, what are you using for scale, right? Are you does your product scale on its own because you depend on events kind of choosing you? But if in that case you need a sales team, you need an effort to kind of make sure that you literally break the partnership that X venue in Santiago has with whatever tickets they use, whatever ticket platform they use. So how are you going to break those chain or those partnerships that they already have? You either have to pay for it, or give them a highly discounted price, or give them some or give them some money back or some sort of thing. Fantastic salespeople, but you got to make sure that you talk about this, because otherwise it could be perceived as these guys are only focused on the product, but they haven't solved the distribution part. But moving you to Anthony, man, like what are you raising $5 million for? That's a hell lot of money.
Yeah, no, for us, it's to distribute our health insurance to 3 to 5 states and to create a household name. It's really important that we establish distribution channels. So 4 channel salespeople that we have as named candidates, another 3 to 4 integration engineers to work on different integrations. Further out are Epic, Microsoft integrations to be able to be listed on their marketplaces. So those create distribution channels, or channel salespeople kick in. They can leverage those enterprise sales teams to be able to sell our product on our behalf. So it's mainly distribution and cornering the market, and specifically the 5 states, starting with Texas and then going on to Colorado, Georgia, Florida, California, Seattle.
I guess that a question that I would have on sort of this offline, I don't know, I like to think of myself like a starter person, tech, whatever. But one thing that I feel that the purchase, like the decision to purchase insurance, would need, like I need a human, or maybe that's my perception until now, but like I needed a human to sort of go through it with me and kind of given the other options. So how are you breaking this barrier, or are people not resisting at all to kind of like doing all of this hands off via bot?
Yeah, I think a perfect analogy, and I think a lot of probably listeners that are listening in, a perfect analogy would be like Root car insurance or Lemonade insurance, right? A lot of people, if you look at Lemonade, that was a typical thing is the initial barrier was, people need someone to get someone on phone before they get renter's insurance. But, if anyone downloads, is renting an apartment and is not on Lemonade Insurance and wants to, you download their app, you can start communicating with their chatbot. And it's just very clear, like all the components that you need to understand about insurance is like, how much coverage do you need? It could always be boiled down to 5 or 6 questions. And if anything, the human gets in the way of selling health insurance. They make it complicated. It's very confusing. Obviously, there's always going to be an opportunity to get us on the phone and we will explain, different plans, etc. But the goal is to get you into our community first, engaging you in your health, offering you health insurance on top of that, and then focusing on, about 40% of America are self-employed or micro businesses and they don't have health insurance. So it's a big, big problem in America. Focusing on that individual, then growing into micro and small and medium-sized businesses in a lockstep order is the way that we'll distribute. But the Lemonade paradigm, if no one's familiar with that paradigm, and Root Car Insurance, these are 2, and Ethos Life Insurance as well. All 3 have done, pretty similar in an industry where you thought you need to get someone on the phone.
Yep, and I think is a good answer. I think you have the answer ready. I'm sure other people have asked it before, so that's great. Guys, I don't have any more questions from my end or comments to add on the decks. A couple of little details on the design for you, Anthony. I love that you're using our GIFs, but the girl on the mirror GIF, I think it wasn't necessary.
Okay.
Yeah, just use like a static background. I think it'll look better.
Yeah.
With insurance, you have this. I think that you're like kind of in this middle ground where you're selling an insurance company, which needs to be somewhat serious, but you're also a startup that's doing it in a very innovative way. So how do you
strike that
balance those two?
Yeah.
The gifts were unnecessary to me. Aside from that, I think that you're doing great. The presentation, same with you, Anthony. I think that the message got pretty clear. Anything else you can do to help you guys out, or anything else you guys want to add before we wrap it up?
No, this is great. I really appreciate the feedback and the time.
Awesome. Thanks for joining us today, Anthony, Bruno. It was a pleasure seeing you both. And thanks everybody that joined in the live stream for watching. Anthony and Bruno are now both on our FounderHub community, so if you want to connect with them, feel free to shoot them a message if you have any questions, thoughts about the deck. I think that hopefully their experience, Anthony, both from Anthony's almost fully committed round to Bruno's earlier stage company. I hope that kind of gives you some perspective on how to how to phrase this deck and how to brag about the stuff that you've already built.
Amen. Thank you.
So,
thanks
a lot
everyone
for watching,
Appreciate
everybody. Thanks a lot for being with us, guys, and we'll see you next week.
Thanks, Kai.
Bye.